Shocking new claims on children's health. Are we treating kids wrong? It's hard to ignore the intensity of today's headlines. The newly released RFK Jr. report on children's health is stirring up fierce debate across the country. And for good reason. Are we failing our kids by over-medicating them? Are the very measures we trust to keep children safe doing more harm than good? Let's break down these controversial findings and uncover what no one else is talking about. Kennedy casts doubt on over-medication and gun violence links. In a recent press conference, Robert F. Kennedy Jr. highlighted a topic that's sure to spark strong opinions. Is medicating children related to rising violence? Although the new report doesn't directly address guns or violence, something a reporter quickly pointed out, Kennedy cautioned that the issue is more nuanced than simply focusing on firearms themselves. According to him, the Trump administration is primarily interested in the broader subject of violence rather than guns alone. Kennedy traced the increase in gun-related violence to the 1990s, despite guns being present in American homes for decades prior. He speculated that several shifts in the 90s could be relevant, particularly the surge in psychiatric medication prescribed to children. Social media's rise and increased exposure to video games were also flagged as possible contributors. In response, the National Institutes of Health (NIH) has started studies exploring whether there's a tangible link between these new lifestyle factors, and especially over-medication and youth violence. And this is where things get especially controversial. Could our attempts to help be making the problem worse? CDC warns that even life-saving vaccines can carry risks. Acting CDC Director Jim O'Neill openly acknowledged something often downplayed in public health discussions. Vaccines, while immensely beneficial, can sometimes lead to unwanted side effects in a small fraction of recipients. That truth must no longer be denied or distorted, O'Neill insisted, promising that the CDC would boost transparency and pursue rigorous research on vaccine safety. For those concerned about COVID vaccines, recent FDA action will resonate. Both Pfizer and Moderna were instructed to update warning labels, noting a rare but real risk of heart inflammation, conditions known as myocarditis and pericarditis. The rate among children and adults under 65 is low, about 8 cases per million doses, although it climbs to 38 per million among males aged 16 to 25. Is this an acceptable risk, given the benefits? The overwhelming scientific consensus remains that vaccines have saved millions of lives, eradicating or drastically reducing diseases that once killed large numbers of children, like polio and measles. For example, a comprehensive 2024 study by the World Health Organization estimates immunizations have prevented at least 154 million deaths globally in the past 50 years, with measles vaccines alone credited for saving some 94 million lives. But here's where opinions get heated. Kennedy, who has at times questioned vaccine safety, recently acknowledged their efficacy in the wake of deadly measles outbreaks. This reversal is bound to raise eyebrows. Should people reconsider their stance on vaccines? Or is skepticism still justified? What do you think? EPA and agriculture officials push for transparency and nutrition reform. EPA Administrator Lee Zeldin turned the spotlight on parents, what he called MAHA moms and dads, pledging that government leaders like Trump and Kennedy are committed to tackling tough health concerns, including the regulation of banned pesticides and the encouragement of new, safer crop protection products. Notably, Agriculture Secretary Brooke Rollins made a forceful call for all states, regardless of politics, to request waivers, limiting junk food eligibility through the Supplemental Nutrition Assistance Program, SNAP. Only 12 states have taken action so far. This bold proposal could transform nutrition support, but risks igniting heated debates about choice and fairness. Should the government decide which foods low-income families buy, or should personal choice always come first? Kennedy cheers for Trump's support of health initiatives. Kennedy expressed gratitude for working alongside President Trump, who he applauded for prioritizing children's welfare, even if those efforts might upset powerful business interests. The president is fearless. Kennedy said, underscoring a willingness to champion potentially unpopular health reforms for the benefit of the nation's youth. Waiting game for new dietary guidelines. Although the report references future plans shaped by updated dietary guidelines for Americans aimed at improving school and community health, no timeline for their release has been confirmed. Why the delay? Is there internal disagreement about what Americans should actually eat? Screen time and food safety. Coming initiatives. Screen time has become nearly unavoidable in children's lives, with mounting research linking excessive media use to cognitive, social, and even physical health issues such as obesity, sleep disturbances, and mental health challenges. The U.S. Surgeon General will launch a public awareness campaign to help families navigate these risks. Meanwhile, the FDA is intensifying efforts to eliminate petroleum-based food dyes from all U.S. products. While manufacturers have been advised to phase out these chemicals, a full ban hasn't yet been imposed. Should the government act more forcefully, or are gradual steps best? Major overhaul. Creating the Administration for a Healthy America. Plans are underway for the Department of Health and Human Services, HHS, to undergo a sweeping reorganization. The goal? Establish the Administration for a Healthy America, AHA, and new NIH offices aimed at turbocharging public health initiatives. A report, however, did not clarify whether this restructuring will lead to job cuts or increased government spending. Restricting junk food in SNAP and launching MAHA boxes. Further food policy changes are on the horizon, with the Department of Agriculture collaborating with states to further restrict the purchase of junk food through SNAP. There's also a new idea, MAHA boxes, which would deliver whole, healthy food to program recipients. Innovative or intrusive? The debate will surely continue. Fluoride under the microscope again. The EPA will re-examine the latest science on possible health effects of fluoride in drinking water, using new studies to update CDC advice. The FDA is also reviewing fluoride-containing products, pledging to remove any found unsafe. Fluoride's role in dental health is widely accepted, but Kennedy's prior warnings about potential risks challenge expert consensus. Do you see fluoride as an essential safeguard or an overlooked danger? No announcement yet on autism's underlying causes. Contrary to some expectations, the report does not specify what causes autism. Instead, it promises that agencies like HHS, NIH, and the Centers for Medicare/Medicaid Services will investigate autism's root causes through new research initiatives. Raising the vaccine injury debate again. Another contentious topic, vaccine injuries. HHS and NIH plan to advance research and monitoring, rolling out a new vaccine injury program. This commitment appears to respond to vaccine skeptics, but could it risk increasing public anxiety? The report's messaging emphasizes the need to maintain and improve the safety and schedule of childhood vaccines while modernizing research standards and addressing potential conflicts of interest. But some